Hi everyone, it's 12 o'clock, so we'll go ahead and get started. Welcome to the Lunch with Links COVID-19 Vaccine Ordering and Reconciliation Training. My name is Brooke Zerang and I'm the COVID-19 Training Coordinator for the Immunizations Program. Joining me today is Adrian Whitney, who is the Vaccine Distribution and Procurement Manager, and Judy Green, who is the Links Operations Manager. They will be presenting on today's topics. This video will be recorded and later posted on the Links website, lalinks.org, under the Links Training Videos button. During this presentation, please type any questions you may have in the chat box. There will be a Q&A session following the training where all questions will be addressed. And with that, I'll now turn it over to Judy and Adrian to start the training. Judy, you can share your screen. I see it.
Sorry, I'm also talking and I'm on mute. Good afternoon, everyone. Glad that you could make it. This session is going to be on how to order vaccines, how to reconcile your inventory, how to create transfers and receive transfers of vaccine. So I think we'll get started. I'm going to log in, and today I'm logging in as an organizational client, as we had some questions yesterday on this. So I'm putting my login and password in. I'm going to log into Links. And because I'm an organizational client, when I log in, that means that there's more than one facility under my organization. So I'm going to have to choose the facility that I want to work in today. And I'm going to choose the COVID site test facility that I'm going to place an order for vaccines. And once I'm in that facility, you'll notice that it shows that I'm logged into the COVID test site organization and the COVID test site facility. And that's really important because in order to place an order for vaccines, you have to be under a facility. We cannot place orders under your organization only. So I'm getting ready to place an order for vaccines. Let me close out some of these things here. So I'm going over to my menu item where it says orders and transfers. I'm going to click on that. Uh-oh. I guess that was okay. Okay, so I'm going over to orders and transfers. I'm going to click on create and view orders. Once I come to this page, I have an option here to create a new order. What it's going to do is it's going to take me straight to the reconciliation inventory page, because in order to place an order, you must first reconcile your inventory. And you may have more than COVID vaccines if you're in a site that also does VFC vaccine. So you'll have to reconcile all your inventory before you can place an order into the system. In this case, I only have one vaccine in the system, and that vaccine is my COVID vaccine, which is a J&J product, and it shows I have 18 doses on hand. If in fact that's what I have on hand, I simply put the 18 here after I go to my refrigerator and count my doses. Once I do that, I must hit submit monthly inventory. I cannot just save it, because if I save it, it will simply send it back to me to the inventory screen before I can place an order. I must submit my inventory. Now, in the event that I don't have the 18 doses, and let's say that I actually only have 17 doses, I'm going to place the 17 there. Then I'm going to have to choose a category and a reason why I don't have as much vaccine as Links is telling me I should have in my inventory. So I go into the categories, and there are several categories here. One of the categories is that I administered the vaccine. If that's the category, the reasons can be that I administered it, but I didn't link it to a vaccine. That usually means that I administered it to someone that did not get put in the registry, so it did not decrement the vaccine, and I can't seem to find out what it is, and I need to place an order, so I'm just going to accept that. The only problem with that is when your order gets to Adrian, who is our vaccine procurement officer, to approve this order, she's going to see those adjustments that were made. And if in fact there are several adjustments made like that, she will be contacting your regional immunization program manager. They will contact you because before that order can be approved, we will have to fix that inventory. If it's patients that didn't get put in the registry for some reason or didn't decrement, they will have to be corrected before the order can be approved. The other reason is administered to a client who chose not to be in the registry. The only way that a client can choose not to be in the registry in the state of Louisiana, because it's an opt-out state, is for them to complete a form, mail it to the New Orleans office, and then it's handled through that office. We cannot just have them just say, well, I don't want my record put in the registry. Just don't put my record in the registry. That's not a legal thing in the state of Louisiana. The other reason would be possibly that we wasted a dose, and you're going to see a lot of this right now, because if we have the 10-dose vials or the 15-dose vials and we only get maybe 14 doses or maybe 9 doses out of a vial, we're to choose the wasted, and our reason would be dose variance. What that means that we didn't draw the dose up and not use it. We didn't just discard the dose. It means that it was wasted because we didn't get but 9 doses instead of 10 out of a vial or some reason like that. But the other reasons for wasted are that we dropped it, spilled it, we drew it up, we did not use it, we could not account for it, or it was damaged in transit. So those are mainly the 2 reasons that you'll have that you adjust your inventory. But in this case, we're going to say that we have a total of 18 doses in our inventory. And once we say that, we're going to say submit our monthly inventory. Once we submit our monthly inventory, we'll be brought to the order screen. Now, if you only have one order set that's available to you, which would be possibly the COVID vaccine, it will automatically show there. But if you have more than one order set that's available to your facility, then you'll need to select your order set in this box. As you see, this one has a private VSC provider order form and a COVID, but we're dealing with the COVID vaccine, so we're going to choose that order set. And once we do, it will bring us the vaccines that are available to us to be able to order, which are your Pfizer, your Moderna, and your J&J. What it's also going to tell our vaccine people when they're working on approving your order, it's going to tell them how many doses you physically have on hand right now, and it's going to tell you if this is your second time ordering, how many doses you actually used last month of this vaccine. So, and that's kind of a help, because if you say have 600 doses of Johnson & Johnson on hand, and you only gave 5 doses last month, but then you're ordering another 400 doses, well, it's going to send up a flag, and they're going to want to know, why are you ordering this much vaccine? And it could be because you're having a special event, which is perfectly fine. But we won't just blanket approve orders of that type without knowing why it is to happen. And as a matter of fact, you can actually put it in the comment section if you would like to, and then they will see that. You could put in there that you're having a special event or something. But today we're going to order some J&J vaccine, and we're going to let's order 20 doses of it. Can I get it in 20 doses, Adrian?
No, it's not
I'm
yet.
sorry.
Do 200.
200 doses, I'm sorry. That just hit me. And I'm going to submit my order. Once I submit my order, I guess, first of all, I have to select my vaccine. Now, you see, this is somebody that does this all the time, so don't feel bad when this happens. But if you don't do everything exactly right, it's going to put you a little red mark up there and tell you that you got to select your vaccine. So I actually have to go in and select the vaccine name, which is the Janssen vaccine. Then I put my 200. Then I can submit my order. Once I do that, it's going to tell me I successfully created, and it's pending state approval. And you can see here where I have an inbound order that was created today. I submitted it and it says pending state approval. Now, once Adrian approves that order and I get my vaccine into my clinic, then I'm ready to accept it into the inbound orders. Once she does that and I get my vaccine in today, then what I'm going to do is I'm going to log back into Link.
That's it. I
Okay, I'm waiting.
I had a little technical difficulty.
Oh,
You can go ahead now.
Okay, you ready now?
Yes.
Okay. I'll go back into create and approve and view orders. And you'll see that the status has changed to approved. Now, the first thing we need to do with the J&J vaccine and the Moderna vaccine is we must go to their website and find the correct expiration date. And I'm going to ask, I meant to have a screenshot of it, but I didn't, I'm sorry. But I'm going to ask Adrian to put the two websites in the chat so that y'all can copy them or write them down, where you will go to get the Moderna lot number and the Janssen lot number. Once you do that, you'll go into each one of them's website, you key in the lot number, and it will automatically tell you the correct expiration date for that vaccine, because it will not be sent to you correct on the box that comes with the vaccine. Only Pfizer vaccine will show the correct expiration date when you get it, when you receive it. Okay, so now I've looked at my J&J lot number, so I'm ready to receive my order. I simply click on the select under the inbound order. When my box opens up, it says that I received 200 doses. I'm going to say I received 200 doses. I'm going to put my manufacturer in. I'm going to key in my lot number. I'm going to enter my expiration date. And I'm going to receive the order. Once I receive the order, I can go over to my lot numbers, reconciliation. And you can now see that I have that 200 doses of Janssen vaccine, J&J vaccine, into my inventory and accepted, and I'm ready to start administering it. Now, I'm going to do one more scenario for you, which this does not happen often, but it can happen every now and then. So I'm going to create one more order. I'm going to go in, I'm going to create another order, and this time I'm going to create an order from Moderna vaccine. I'm going to create this order. It's not going to, because I've reconciled within the last 24 hours, it will not force me to do another reconciliation. It will take me straight to my order page. Only if you have not reconciled within 24 hours will you have to do a reconciliation before you place your order, which very seldom happens, but just in case you don't, it'll take you straight to your reconciliation page. So this time, I'm going to select my COVID. And this time I'm going to order the Moderna vaccine, and I'm going to order 200 doses of that. And I'm going to submit my order. Okay, now I have that one waiting for Adrian to approve it. Okay.
It's done.
Okay. Once she approves that, then I get my vaccine in. Okay. And here's my order I placed on my Moderna vaccine, and it shows approved. Now, I get my vaccine in, and I look, and all of a sudden I realize they have sent me 2 different lot numbers. They have sent me 100 doses of one lot number and 100 doses of another lot number. So, as I said, this is not going to happen a lot, but we may see it happening more in the future with the amount of vaccine that we'll be distributing. So what I'm going to do in this case is I'm going to select my inbound order. First of all, I'm going to go to the Moderna website, and I'm going to get the correct expiration date for each one of the lot numbers, because they could be different. Okay, so I'm going to say I got 100 doses of one lot number. So in my receipt quantity, I'm going to simply type 100. I'm going to select my Moderna vaccine. I'm going to enter my lot number. And I'm going to enter my expiration date for it. And at that time, I'm going to receive that 100 doses. And it's going to pop a little thing up, and it's going to tell me that it's a difference in how many I'm receiving and how many I'm rejecting. It says if you elect to continue, the items not received will remain on the order as requiring receipt, which is what I want it to do, because I still got to receive my others. So I'm going to say, yes, I want to receive my 100 doses. And once I do that, automatically, if it works right, there we go. Automatically, it gives me another line here. It shows you where I received that 100, but it's showing I've got another 100 to receive. So I'm going to say I've got 100 more. It's Moderna. My lot number for it is going to be A12072A, and its expiration is going to be 07/31/21, and I'm going to receive it. Then I go to my reconciliation page. And it's going to show where I accepted 100 doses of each one of those lot numbers from Moderna vaccine. I think maybe now we could pause for some questions on this. Brooke, would you like to, or?
Yeah, I'll start reading them out. The first question, can we actually order J&J yet?
I'm sorry, I didn't understand that.
Can we actually start ordering Johnson & Johnson vaccine yet?
Adrian?
You will be able to order vaccine if I have doses available. So some of you on this that are on the call are VFC providers and familiar with flu vaccine. So the way the vaccine works, we don't get everything at one time when it comes to the COVID vaccine. I get 2 allocations a week. And the allocation, we have no control over the allocation. So if I have doses available, you will be able to place an order for the vaccine. If I don't have doses available, then that means you will not be able to click on the vaccine. So the way we process orders is first in and first out. So depending upon when you placed your order, you may have at that time placed an order for J&J vaccine, and then maybe by the time that I've gotten to your order, I may have ran out. I will deny your order. So, and the reason why, I'll give you a reason, is supply is not available. So whenever you place your order, I would suggest you all check the status. The next day, it's a team of me and 2 other people. So it'll take us 1 or 2 days to process the order.
Okay, the next question, what are the order quantities that we have available to us right now?
So what we're going to do is you can only order the Moderna and the J&J vaccine in increments of 100 doses. And you can order the Pfizer vaccine in increments of 1170. But we will open the order form where you can order it in increments of 6 and 10. So if you do place an order that is less than 100 doses, we're going to send that order to Morrison-Dixon, who is our local distributor in Shreveport, and they are going to ship your vaccine. Any other vaccines that come in increments of 100, we're going to send that to McKesson and Pfizer, of course, the 1170, and they're going to be the ones that's going to process your order. If you place an order for 250 doses or 280 doses, we're going to either round up or round down to have it as a whole number to process your order. So we suggest when you do place orders in increments of 100, and those that's less than 100, we'll go ahead and process that through Morrison-Dixon.
The next question is, can we add a new person to do the ordering?
Yes, and that question is a good question. What we do is when your COVID application is sent to our office and we set up that COVID application, the two people that are listed on that COVID application as the primary and backup vaccine coordinators are the two that were set up to handle the vaccine orders and to handle the vaccine inventory, etc. Now, we prefer that you only have two people per site. If you want to have more, it causes confusion sometime, and you'll have somebody thinking, well, I made an order, but the other one actually made the order, or I adjusted some inventory, but the other one did it. But if you want an extra person, we will do it. You'll just need to go to the home page of links. I'm sorry, I just got off base. You don't have to go to the home page. If they have access to links already, all you need to do is send an email to your regional immunization consultant asking them to add this person or replace a person. You can tell them, we have this person that is our coordinator, but that person is no longer available to do it. We would like to replace them with such and such person. If they do not have access to links, you will need to go to the home page, get an individual user agreement form of the enrollment documents, complete that, and when they complete that form, make a note on there, we wish this person to have lot number privileges. And then that will be sent to your regional coordinator. That person will send it to us to process.
Okay, the next question. We have Johnson & Johnson vaccine on hand through our federal program. Are we supposed to report every time we administer a dose to links?
Yes, if you have Johnson & Johnson currently on hand, you should have entered it into your inventory in links. And then when you administer the vaccine, you should be decremented and added as administered, just like you do any other vaccine.
Adrian, I know you said this earlier, but just to clarify, how long does state approval when ordering a vaccine usually take?
I would suggest the actual approval process to take 1 to 2 days. Give us 1 to 2 days to get to the actual order and approve it, and you should receive your vaccine 3 to 5 business days later. So like, for instance, if you place an order on a Friday, you'll probably get it that Monday or Tuesday.
We normally do not reconcile until we know for sure how many Angel doses we will get. So this would not happen before we need to order?
At the time you place the order, you need to reconcile with what you have in your refrigerator at that time. If you have 5 vials with 6 in the vial, like Pfizer is now, then you're gonna assume you have 30 doses, because you're gonna make the Angel dose adjustment after you realize that you have used those Angel doses, if you get more than 6 doses, or if you get less than 6 doses. So what you need to put in your reconciliation at the time of placing an order is according to what you have in your refrigerator, which was shipped to you as 6-dose vials or 10-dose vials.
Can you order multiple products on the same form?
We suggest smaller facilities stick to one product, but we understand we do have larger health systems that have multiple products. So if we have those doses available at that time, we don't have a problem with that.
Okay, the next question, is there a cutoff time for each week? What is turnaround time from ordering to shipping?
There's no cutoff time. You can just order as needed, and after your order has been approved, wait 3 to 5 days to receive shipment. So if you wanted to place an order at 1 o'clock in the morning, you can have it.
Do we have to order Moderna in multiples of 100? Can I order 120?
If you order in 100, we prefer if you order in multiples of 100, but if you order 120, I'm going to round down to 100 to make it easy for us to place the order, because they only ship in multiples of 100.
When does this ordering system go live?
It goes live on the 15th. I think that's what the Hines said, correct, Brooke? I think it's the 15th.
I'll have to verify it.
I'm looking right now. It goes live the 15th. I'm sorry, Wednesday the 14th. I'm looking at the wrong day. It's Wednesday the 14th at 8 a.m. The ordering process will go live.
Next question. So a Pfizer order less than 1,170 doses will come from Morrison Dixon?
Correct. So you'll still be able to place the order. We're just going to batch those orders and give those to Morrison Dixon, and they'll handle those. And the process is still, nothing has changed with the process as far as Morrison Dixon still contacting you, or McKesson and Pfizer still sending you those emails. All that process is going to remain the same.
The next one, we received 100 initial doses of Moderna on March 22nd. We will automatically receive second doses around April 20th, as before, or must we request these second doses via links now?
I'm looking at the date. So yes, you'll be able to place your order for second doses. That's correct. So I would suggest when the order form opens up, place your order for second doses.
So they won't come automatically?
No, doses will not come automatically. We were the ones internally that was automatically sending you your doses. So now if you receive first doses and it's time for you to order your second doses, you're going to have to order your second doses. No vaccine is coming automatically anymore.
Thank you.
So this is Lindsay. I have one question to that. If that's the case, and let's say we do get angel doses, but then I request 120 to cover my angel doses, and you guys round down to 100, how will I guarantee that I have enough second doses for the folks that I gave first doses to?
So what you can do is you can place another order for 20 doses, and we'll still process it. Those 20 doses will just come from Morrison Dixon.
Okay, the next question in the chat box. Referring back to the question with the federal program, do we enter patient information as well into links? Just want to clarify that we are reporting correctly.
Yes, your vaccine that you administer through the federal program, that patient needs to go into link as an administered vaccine, like any vaccine that you get from the state, because the federal government says that we have to account for and record every dose that's given.
The next statement, even though the doses has been entered into links, it doesn't always subtract from our available quantity.
If that's the case and you realize that that's happening, then you need to contact your regional immunization consultant, or you can go to the help desk on the link's homepage, and someone will assist you with trying to figure out why that's not working correctly. And in a lot of cases, if you're doing electronic transmissions, that will happen because the inventory maybe wasn't in there when you started administering the vaccines. There might have been something wrong with the message that was sent over through your HL7 messaging. And we have ways of looking at all that and figuring out what's going on, and we can assist you in getting those corrected.
All right, the next question. Which set weeks of first doses will be the last week that auto ships second doses?
We're placing orders today for this will be the last week of first doses. That's automatically being shipped. So after that, you will have to place your own order for those second doses for whatever's going to be shipped today. Well, not shipped, but processed today.
After we reconcile to order, will we be able to reconcile again to add the angel doses for Moderna?
Yes, you can reconcile your order, your inventory anytime you would like. And the only time you have to submit it to us is if you're placing an order. But other than that, you can add your, go into your reconciliation, add your angel doses and just save it, or you can submit it if you want to. It's your choice.
How do we request for the week of the 19th? Do we have to wait until the 14th to order?
That is correct.
If 1,170 Pfizer doses are ordered, will it be shipped frozen? And if less than 1,170, will it be shipped refrigerated or at -20 frozen?
If you are ordering 1170, it's going to come directly from Pfizer. So it's going to come in a thermal shipper with the dry ice. If you order less than that, it is going to come from Morrison-Dixon. And Morrison-Dixon delivers it refrigerated, of which you have the 4.5 days to utilize it.
I think you just answered this one, but just to make sure. The LA Han notice says we can order Pfizer in increments of 6. So will you still round the 120 doses down to 100?
Not the 6 doses. When I was speaking of the increments of 100, I was really referring to the Moderna and the James.
And the last question we have in the chat box. We submitted the request by to order vaccines to be delivered the week of April 12th and haven't had any response. Does this mean we won't receive a shipment?
I suggest you email la.immunization@la.gov, and I'll put that in the chat box.
If anyone else has any questions, feel free to type it in the chat box or unmute yourself.
Okay, if no further questions, I'm just going to go over how to make a transfer and how to receive that transfer. So what I'm going to do this time is I'm going to go back to my orders and transfers menu, and I'm the COVID site test that's under this COVID test site organization. And I want to transfer some vaccine to my other facility that is in this same organization. So what I'm going to do is I'm going to go into create and view orders, and then I'm going to create a transfer. I'm going to go into the receiving. I'm already in my site. So I'm going to go and I'm going to send this. And if I'm sending it to somebody in my site, I'm going to pull up the COVID test site. But if I'm going to submit it to somebody that's outside my organization, you'll have the choice of all the organizations that are in the system that you will be able to transfer the vaccine to. Now, the catch there is, unless that organization is COVID registered, you will not be able to transfer vaccine to them because they won't have you won't have the privilege of bringing them up in order to make a transfer to them. Only COVID registered will be in the receiving facility site. Now you'll see all of the organizations, like we can look at Acadiana Pediatrics, that's the first one that happens to be up here. But as you will see with them, you don't see a facility that I'm able to, well, actually I am because they're BFC and they are registered. I'm sorry, but forget I said that. Anyway, if you try to transfer to one that's not COVID registered, it will not appear under the facility, receiving facility. But I'm just going to go ahead and transfer some I'm going to transfer some vaccine over to the LA Immunization Program. So their organization is the LA Immunization Program. And once I go there, then I'm going to select the facility that I want to transfer it to, and I'm going to select it to the Louisiana Immunization Program. And they need some vaccine, and I have more than what I'm going to use. So I'm going to send them 100 doses of my Janssen vaccine here. And I'm just going to say that it's COVID transfer, or I can say whatever I wanted. I can say COVID vaccine. We use that a lot. And once I do that, I'm going to send them 100 doses. I'm going to create the transfer. And you'll see that there's an outbound transfer sitting there waiting for the immunization program to accept it. So when that immunization program accepts that vaccine, they're going to be logged in. I just went to the wrong thing. This thing is not letting me. Oh, I can't do this because I'm hooked up to the COVID test site. I'm sorry, I forgot I was. Okay, let me. I'll have to log out and log back in. So I'm now at the immunization program that you have transferred this vaccine to me. You brought it to my office, or I've gone to your office and picked it up, and I'm ready to put it into my inventory. So I'm logged in now to the Louisiana Immunization Program facility. I'm going to go down to my create and view orders. And I'm going to go all the way down here to the bottom, which I should have known I had all these orders in here. And you see I have an inbound transfer sitting here that was submitted on the today, and it's from the COVID test site, and it's been approved. It's automatically approved when they make that transfer. So I'm going to select that transfer. And I got 100 doses. It's already going to have my lot number there, my manufacturer, my expiration date, everything's there for me. All I have to do is say I received 100 doses. I click on receive. I go to my reconciliation page. And right here is my 100 doses of vaccine that I just received. If I go back to my COVID test site, if you're at the COVID test site, you want to make sure that they have received that vaccine. I'm going back to my create and view orders. And you notice that outbound transfer is gone because they've received it. I can go to my reconciliation page. And it has removed that 100 doses of that J&J vaccine from my inventory. Now, let's say that I'm going to transfer, let's say I'm going to transfer 50 doses of this lot number. I'm not going to do it that way. I'm going to go and create a viewer order again and say that my other COVID test site says that they need 50 doses of my vaccine. So I'm going to create a transfer for them. And I'm going to say I'm going to transfer them 50 doses. I'm going to create this. I'm going to select my COVID test site, my other facility here. Hope. Okay, that's where I'm going to transfer it to. I'm going to create the transfer. And after I've created this transfer, a couple of hours later, they call me and tell me they didn't really need this vaccine, so they're not going to come pick it up. So I've got this sitting in my outbound transfer order. So once they tell me we're not coming to pick that vaccine up, it's going to remain in my inventory. So what we're going to do is we're going to come back to this outbound transfers. We're going to select it. And we're going to delete that transfer. And that way it's no longer in my outbound, it just remains in my inventory. Any questions on that?
I have a question.
Okay.
So let's say they say for the transfer one, when you're canceling the order, what if they say they need 50, but now they just need 50 instead of the 50? Is it the same exact process?
Yeah, what you would, y'all, I'm sorry, I've got people out working in my yard and my dogs are going ballistic. Let me shut this door, see if it'll help. What will happen in that case, if they decided they didn't want 50, they just wanted 20, then just go ahead and delete that transfer and create another transfer form.
Okay, thank you.
Uh-huh.
Judy, there are a few questions in the chat box. The first question, is Morrison-Dixon not now delivering Pfizer frozen, which can be maintained for 13 days plus an additional 120 hours in the fridge? This was a change when Pfizer got approval to store at regular frozen temperature.
I'm gonna have to double check that because I really don't know. I'll find out that information.
The next question, was it said that once we receive orders from Morrison-Dixon that they must be used in 4.5 days?
That's if they're delivered refrigerated, but that goes back to the last question. I'm gonna find out that answer.
The next question, will we be receiving syringes and supplies with the vaccines again?
Oh, yes, ancillary kits automatically come with the vaccine. So every time when we were placing the orders, it's still the same process. The only difference is now you all are going to be placing the orders. And you don't have to place an order for the ancillary supplies. Once the vaccine is ordered, they're going to match that same amount. That's an automatic.
Can we order multiple times per week?
Only if we see that you're utilizing the vaccine.
Last question, clarification on the rounding down. Am I only going to receive 100 or will I get 100 from state and 20 from Morrison-Dixon?
if you need, so say for instance, if you were ordering 120 doses and it was Pfizer, then that's gonna come directly from Morrison Dixon. So to answer, for Moderna. So if you need 100, and this goes back to when Judy was showing you how you can make comments in the section at the top when you place your order. If you absolutely need 120 doses, I would suggest you order 200 doses.
Will we still receive orders on Monday?
Orders are going to be coming throughout the week. So if you place your order, before we had a cadence that we would place orders for you all on Thursday and Friday, they automatically came on Monday. So now you can place your order any time of the week, any day of the week, and you're going to get it 3 to 5 business days after that. They're not going to ship anything on the weekend.
They didn't have the yellow, they didn't say anything about the yellow.
Last question. There is conflicting information out there on the time between first and second dose. What are the time requirements between the first and second dose? We have that it is 17 till 21 days for Pfizer and 26 to 31 for Moderna, no later than 42 days for both. Is that the time you give?
This one is for your analysis.
I haven't heard any conflicting information. Is that something different that they're reporting, or? Oh, okay, you know what? I understand your question. So for right now, that is correct. You're not to administer the vaccine no more than 42 days after the first dose, between the second dose. You are absolutely correct on that. But I know this information, we had a question on that about a week and a half before, and I know they said they were supposed to give more guidance on it, but I haven't seen anything yet. So I understand what you're talking about.
But the only cuts option.
Is the grace period, give or take 4 days, whether it's 21 or 28 days?
Yes, the grace period is still plus or minus 4 days.
That's it for questions in the chat box.
Well, I'd like to say I appreciate so many people coming on today. And like I said, if I'm going to show the homepage of links at this time. If you have any further questions.
Well, I actually do have a question.
Okay.
Because I just saw the thing about no later than 42 days. So what happens if someone doesn't receive their second vaccine within that 42 days? What do we tell? Do we send them somewhere? Or what do we tell them?
No, as of right now, CDC does not, they have, the guidance is do not vaccinate, because they don't have any data on what happens if you give after 42 days.
Okay, thank you.
Okay, on the homepage of links, we have a help desk, we have an email, we have a chat box, we have a phone number, and also right beside the calendar, the state map, you have the consultant for each region listed with their contact information. And now I would like to, Katie, you are on, correct?
I think she said she was out of office today.
Oh, is she? Oh, okay. All right. And I don't have the information for the new learning system, but I think it's on the LDH website, isn't it, Brooke?
I don't think it is. I think she said it was in the document center.
Is it? Oh, okay. All right. Well, I can show it. We have a new learning, what we call a learning management system that's set up in Link. And if you go under the document center, we have a LA Links LMS account tutorial right here. And what it is we have, you can go into this document and it will show you how to go onto the LMS and sign up to take the courses that we have designed for the Link system. And each course will actually, after you do the little course, they're all just several minutes long, it will have a little question and answer thing at the end that you can actually test to see how well you did. But if you go into this, it shows you where to go, the website to go to, how to sign up to get it, and it will show you how to select your courses. And it's all a links training portal is what it is. So I really strongly suggest that you go into this. It has many videos on there that will certainly help you in learning the system. It has videos on how to add patients, how to look for patients, how to add vaccines. Or you can go on the home page. We still have the learning training videos here, which are the same ones that are used through the LMS. As you see, we have how to create orders, how to administer a vaccine, how to run the patient detail report, how to transfer and receive vaccine, how to vaccine orders and reconciliation. So all these training videos are very helpful, and most all of them are no more than 4 minutes long. It's just about the length of the longest one. So, but I do encourage you to go to the document center and sign up to do the LMS training, because like I said, it will show you the little video, and then you'll have a few little questions afterwards in case you have any questions about it. And that's all I have if no one has anything else.
I do, Judy. I just put in the chat box the updated MMWR about the 42 days. They said the series does not need to be restarted, but if you vaccinate, there is no data to say how effective it's going to be.
Oh, okay. Very good.
Yeah, so I put the MMWR in the chat box.
I did have one question too. We had a patient that took her first Moderna, and it's past the 42 days for the second Moderna, but she was wanting to get the Janssen vaccine. What is the recommendation on that?
I suggest you send that question to the la.immunization@la.gov.
All right, LA documentation.
Yeah, I have it in the chat box. I'll type it again.
Okay,
I'll type it again.
Thank you.
There's a few more questions, Judy.
Okay.
Do we have to update the addresses if the patient is already in links?
Yes, it's very important that you go, when you pull up your patient in links, if you do not see an address that you have put in, then it's real important that you edit that record, put the most current address, because that's the way that sometimes we're able to send out messages through their phone or through their, especially their cell phone, to remind them that they have that next dose that's due. And also the race and ethnicity are very important parts of that. So it's real important to update the demographic information. If you do HL7 messaging, it's automatically updated anytime they send an HL7 message over to us, if your facility does electronic transmissions to us.
That's all the questions in the chat box. Adrian or Judy, do you have anything else that you would like to add before we close?
No, I just appreciate all the good turnout today. And if you have any questions, I just encourage you to contact the help desk or contact any of the consultants that's listed on the homepage of links. And I thank you for
Adrian,
your
anything
time.
from you?
I don't have anything else.
Thank you all for attending today's training. In case you missed anything or need clarification, we will have another Lunch with Links training on ordering and reconciling tomorrow at 12 p.m. We are also planning to have 2 additional trainings at the beginning of next week. We are finalizing the times by the end of today. There's also another upcoming training for vaccine storage and handling next week at 11 a.m. on Thursday, April 15th. You can find all upcoming trainings on the LDH website on the provider webpage. For any links questions, please email la.links@la.gov. Thank you for coming today.